A subcutaneous injection, or a subq injection, is a shot given under the skin but not all the way to the muscle. Certain medications need to be given under the skin for them to work correctly. The first step in preparing to give a subcutaneous injection is to make sure you have all your supplies needed and ready. Your kit should contain syringes and alcohol swabs. Typically, the needle is 1/2 inch in length, but this can vary. Syringes also come in different sizes, so make sure you know how much medication you are to draw up with each dose. The label that has your name on it will tell you the exact amount of medication you are to draw up with each dose, how often, and where to inject it. In this video, we are going to show you the steps for a subcutaneous injection. Always make sure you check the beyond use date on your medication label. If today's date is beyond that date, or it has been 28 days since you first punctured the vial, you should give us a call for a refill. Also, check that the medication in the vial is not cloudy and contains no particulates. Always wash your hands prior to getting ready for the injection. You can wear gloves to give the injection, and some people prefer to have a bandage open to cover the injection area once complete. To prepare the vial, remove the tamper-evident seal that is on top of the vial. This can be discarded or placed back on top after use, but does not aid in the sterility of the vial. At this point, open one alcohol swab and use it to swipe the top of the vial. You want to do this before each injection so as to sterilize the top of the stopper. Let this air dry and do not touch the top of the vial with your fingers. Use a second clean alcohol swab to clean off the exact area on the body to be injected into. Let that area air dry. If you are given separate needles and syringes, you can simply assemble the syringe like this. Be careful not to touch the parts of the syringe and needle with your fingers. That's the sterile part. So you can assemble your own syringe if you were given two different pieces. Your syringe should look like this. The three parts of the syringe are the needle, the barrel, and the plunger. The needle goes into the skin, the barrel holds the medication and is marked in milliliters or units, and the plunger, if you take this plastic cap off, the plunger moves the medication up and down the syringe. You will want to prepare your syringe with medication by first drawing back an equivalent amount of air into the syringe as to what your dose states. This will help differentiate the pressure in the vial once you draw the medication up. In this case, let's use 1/2 or 0.5 milliliters. So you'll pull the plunger back to the 0.5 milliliter mark on the syringe. The top black line of the plunger should line up with the mark where you want to pull back your dose. At this point, push the top of the needle into the rubber stopper, invert the vial, inject the air into the vial, and pull back down to your specific dose. Make sure the tip of the needle is underneath the surface of the medication so you don't pull back air. If you are getting air bubbles in your syringe, you can push the medication back up into the vial and then continue to pull back down. Slowly draw back until the top black line of the plunger is at your specified dose. In this case, we're using 50 units or 0.5 milliliters. Once you have your specific dose, pull the syringe from the medication and check that you have your specific dose that we talked about. If there are any air bubbles in the top of your syringe, you can kind of tap or flick the syringe a little bit and make sure the bubbles go to the top, and you can slowly push your plunger up and get those air bubbles out. At this point, you are ready to inject into your previously cleaned site on the body. Please watch the video entitled Subcutaneous Injections, Injection Site to proceed in giving the subcutaneous injection. As always, please contact us if you have any questions about drawing up your medication.